Hello.
Hi.
Hi, I'm a level 1 nursing student. My name's Joe, and I was wondering if I could watch you give medication to your patient today.
Yeah, I'm actually about to administer an antibiotic IV.
Oh, cool. Could you give me the S bar in your patient?
Okay. So my patient is Shanana O'Connor. She's in room 231. She's 34 years old and she is a female. She does have one allergy to trimethoprim sulfamethoxazole, and she is full code. Her admit doctor is Engelbert. She's 177 pounds, 5'9", with a BMI of 26.1. And she was brought in here for a primary diagnosis of a fever from undetermined origin. And her secondary diagnosis is end-stage renal disease. She's been type 1 diabetic since age 8, and she was diagnosed with end-stage renal disease 1 year ago. And she has a history of recurrent UTIs. She has a pain of 4, denies change in vision or hearing, reports numbness and tingling in lower legs. She has myodiaphoresis and a functioning AV graft, and it's clean, intact, with thrill and brewery present. She has a capillary refill less than 4 seconds, positive perla, but she does have sensations diminished in her lower legs. She denies any shortness of breath, denies recent colds, reports quitting smoking 2 years ago, and when we auscultated her lungs, all lobes were clear. She denies any chest pain or palpitations, reports elevated blood glucose over the past few days, and her normal dose of insulin is not controlling it well. She's tachycardic, S1, S2 is present, no murmur noted, 1+ non-pitting edema in lower extremities, and +1 pedal pulse in both feet. She's on a renal disease diet, and she has a 1,500 milliliter fluid restriction, and she reports a weight gain of 10 pounds over a few weeks. But she does have a decreased appetite and a decreased intake. And she denies any abdominal pain, denies change in bowel habits. Her abdomen is soft, round, non-tender, and the bowel sounds are present in all 4 quadrants. She has an intake of 375 milliliters, an output of 200 milliliters, and reports a decreased frequency and volume of urination. She states that her urine is darker and more concentrated than usual. She denies any pain, burning, or difficulty urinating, and no bladder distension. Her vital signs that were taken at 07:30 were 101.1 for the temperature, a heart rate of 95, oxygen 96, and a blood pressure of 138/78, and respirations of 20. Her blood pressure is high, but she does have a history of hypertension, so we'll want to monitor that. And we'll want to monitor her temperature because she is having a fever. In the urinalysis, she has cloudy amber urine, and her white blood cells are high at 15. And today we'll be administering imipenem cilastatin IV and sodium chloride 9%, normal saline as the primary, and the antibiotic as the piggyback. And that's my S-bar.
So why specifically is this client receiving this medication?
Well, Shanana O'Connor has a fever of undetermined origin, so that's why she's here. She also has an elevated white blood cell count we saw from her urinalysis. We haven't gotten her culture back yet, so we're going to just want to give her a broad spectrum antibiotic for that. So we'll be giving imipenem cilastatin for it, and it's bactericidal, so we'll just want to monitor that, and it'll help against the suspected infection.
And what action does it have on the body?
Imipenem cilastatin binds to the bacterial cell wall and kills the cell, so it's bactericidal, but cilastatin with it will prevent renal inactivation of the imipenem. So I think I said imipenem binds to the bacterial cell wall. I'm just making sure I didn't mix them up.
Okay. So when should you question administering this medication?
Well, you want to question it if somebody has an allergy or hypersensitivity to imipenem cilastatin, or a cross-sensitivity to cephalosporins or penicillins, but in this case her trimethoprim sulfamethoxazole does not interfere with administering this medication, but she does have renal disease, so we'll lower the dose and make sure it's within safe ranges to administer to her.
Okay. Is there a therapeutic serum level?
There is not a therapeutic serum level. We'll just monitor her white blood cells and her fever to make sure that it is being therapeutic towards the infection.
Which vital signs must be monitored?
You'll want to monitor all of her vital signs. We'll want to monitor her temperature, make sure it's going down. Monitor her white blood cell counts and make sure that they're going down as well. And we'll just want to monitor her blood glucose because that also has been high. And her blood pressure because she does have a history of hypertension.
Okay. What physiological parameters should be monitored when the medication is being administered?
Well, for this medication, we'll want to watch out for signs of infection. She has stated that she's had darker urine, so we'll want to make sure that we're seeing a lightening of the color. Just again, we'll watch the white blood cell count, make sure that's going up, going down. And her fever, make sure that's going down. And also we'll want to monitor for signs of anaphylaxis like rash, laryngeal edema, or wheezing. And just make sure the white blood cell count's going down.
What interventions must be taught to the client to ensure medication is safely administered in the hospital and at home?
Well, for making sure it's safely administered, you'll want to just do proper safety precautions. You'll want to wash your hands, wear gloves, always check the IV bag, make sure it's the right medication, make sure it's not expired, always do in the hospital, make sure always doing your 3 checks to make sure it is the right medication and everything. And when you'll want to check it for leaks, any tears, if it's clear or if it's cloudy, if it's supposed to be cloudy, and if it's expired, and just making sure that they always know to finish out their antibiotics and to take it as prescribed and to not share it with anybody. And when they are setting up, they'll want to make sure that they're always wiping down the ports with alcohol and capping them with the alcohol caps, and making sure flushing it to make sure it's patent. Making sure there's no bubbles in the tubing, and making sure that the medication that you are mixing can be mixed together, checking in a med book or with the pharmacist, and just checking for signs of IV complications, like redness, infiltration, or phlebitis. And just asking for pain before you administer it, and just always assessing the site.
What are the side effects and potential adverse reactions?
Some of the common side effects are diarrhea, rash, vomiting, and nausea. But if you experience diarrhea, you'll want to make sure you come in right away because you could have C. diff. So we'll want to make sure that the patient knows that.
How will you know the medication is effective?
You'll know it's effective when the signs of infection, like an elevated white blood cell count and a high fever, is diminished.
Awesome.
Okay. So would you like to come with me to administer the medication?
Yes, I would.
Okay, great. So, just going to go into the chart. So we're going to check and make sure it's the right person. So we have Shannon O'Connor, age 34, and now I'm just going to compare the doctor's order to the MAR to make sure they match up before we go in. So the primary line that we'll be setting up is sodium chloride 9.9% normal saline. So, and it matches here. So, and then we have for Shannon O'Connor, and the time is 06:30 that it's due. The rate is 30 milliliters an hour, and it's through IV, and it's continuous. So those all match up. So then we'll check with the antibiotic. Imipenem-cilastatin, so it's imipenem-cilastatin for Shannon O'Connor, 06:30, and the dose is 500 milligrams, and it's going to be IV piggyback. Okay, so those all match up, so that's good. So now we'll just go ahead into the room and say hi to the patient. Knock on the door. All right. Hi, Shannon.
Hello.
I'm here to give you your antibiotic for your fever.
Awesome.
And you also have an elevated white blood cell count.
Oh,
so this will
okay.
help with both of those things, okay?
Alrighty.
I'm gonna wash my hands. So have you had IVs before?
Yes, I have.
Okay, and have you had any complications, any swelling, pain, redness?
No, I haven't.
Okay, great. So we'll be giving you an antibiotic today, and I know you do have an allergy to sulfa, but it doesn't affect that. So could you just read me your name and your age, please?
It's Shanann O'Connor, age 34.
Okay, and your allergies?
It's trimethoprim sulfamexazole.
Okay, thank you. So we'll check it here. Shanann O'Connor, 34, and the one allergy, trimethoprim sulfamexazole. Okay, good. So now we'll just get out our first medication, which is the primary line. And actually, I'm going to check both of these to make sure they're not expired before I get going. So this one, 2018, it's not expired. In 2018, check it for any leaks, tears. If it's cloudy, looks good. Okay, this one looks good. Okay, good. So we'll do our first check for sodium chloride. Okay, so we'll check. Could you tell me your name and your age, please?
Shanann O'Connor, age 34.
Perfect. Because we have the right person. The drug is sodium chloride, 0.9%, and it's due at 06:30. It's 8 o'clock right now, so we'll need to administer that quickly. The rate is 30 milliliters over an hour, and the route is intravenously, and it's continuous infusion. So that's our primary line, okay? Let's write that here. So now I'll go ahead and put my gloves on. Well, actually, I'm going to check the drug guide to make sure these can be mixed together before I go and set it all up. Okay. So they can be mixed together safely. And it does say for patients with renal disease, you will need to lower the dose, so we will be doing that. And it's appropriate because it's for infections. So, good, okay. So now I'll put my gloves on. Yeah. I'm going to go ahead and I'll do my second check, and then I will flush her site. Okay, let's check it again. Could you tell me your name, please?
It's Shanann O'Connor, age 34.
Okay, and that's right, and the medication is sodium chloride. She doesn't have an allergy to this. So the time is 06:30. The rate is 30 milliliters per hour, and it is intravenous. So this is going to be our primary line, so I'll just put that here until I set it up. Okay, but for now, I'm just going to go ahead and flush the site to make sure that it's painted. So we'll want to make sure that this is close for now. So I will just wipe this off, put this here. Wipe this off for 15 seconds. Okay, it's clean now, and I have a new sterile saline flush. Just put that on there. Okay, and I'll check. And you're not having any pain here, right?
No pain, no.
Okay, and I'll watch it. IV site, I don't see any signs of phlebitis or infiltration. I'll just watch as I put it, and there's no swelling around here. Having any pain now as I'm putting it?
No.
Okay. Now I'll draw back a little bit, and I got some blood return, so that's good. So then I'll just push it in. Okay. So I'll make sure it's locked. Make sure that goes back in there. Okay. So I'm actually going to leave this attached because that will keep it sterile. Just lock it. Okay. will go ahead and scan my patient. Beep. And medication, beep. Okay. Now we will enter it into here, and our scanner is actually broken today, so I'll just be manually entering it. 8, 2, 3, 4, 3660. Okay, Shanana O'Connor, and we'll go to medication. Just do this. D9, 89, 02, 986, 8399. D. Okay. So we have our green light for sodium chloride, if you want to show that. Okay. So, then we'll just do our third check before. So let's see, it's for Shanana O'Connor. Could you tell me your name and age again?
It's Shanana O'Connor, age 34.
Okay, thank you. That's correct, so we know we have the right person. The drug is sodium chloride, 0.9%. The rate is 30 milliliters an hour, and it's for 0630. So it is within the time range, and it's intravenous. Okay, great. And I checked it's not expired or anything, and it's clear, no tears. So I can put that there. So I am going to go ahead and connect my tubing. So since this is simulation, it usually would be a new sterile bag, but I do not have that, so we will just assume that that is a new bag. Okay. That out. Okay, go. And we want to make sure that it is clamped, so it doesn't go everywhere. Okay, good. So since I don't have a pump, I'm going to be using a dial-a-flow. Just get this untangled. So I'll just connect that in here and prime it all together so that there's no air inside the dial-a-flow. Okay, there we go. So, I get the dial-a-flow. So I will, just to be safe, wipe this off, 15 seconds. Even though when it's a sterile new package, you won't need to wipe it off because it's all sterile. And then to connect this part, wipe this off too. Okay. Let's connect those two. Actually, this part. Set that on too. Never can be too clean in the hospital. So, I'm going to actually just slide this here really quickly. This here. Keep this clean. And just to make sure before I connect it to this, if there is a blockage, I'll know that it is from the tubing, not from the dial-a-flow. I'll just go ahead and flush this. Let's take our flush. nose through. Good. Okay. That is still clean. Just in case, I'll wipe it off again. Okay. And in a hospital, we would have all these capped with alcohol caps just to make sure to reduce the risk of infection. So I'll just connect that there. Now that I flushed that, I know that's good. So I'll go ahead and I'll prime my tubing with this on it. Okay. I'm going to undo the lock. Let that flow through. Make sure there's not another lock on here. There we go. Make sure. Nope, that's not locked. I'm gonna make sure that this is off. Make sure it's open. Okay, now let me try that. There we go. Now it's running through. So I'll just let that go. So we have no air bubbles in it. Okay, great. Just okay. There we go. Locked it. Okay. Now let's check for any air bubbles. Good. Okay, and no air bubbles. Great. So now just before I have done my checks, I'll just check it one more time to make sure before I actually hook it into the person that it's safe. So Chin and O'Connor, I'll check the wristbands. Yes, 34. And could you tell me?
Shannon O'Connor, age 34.
Thank you. Okay, and the medication is sodium chloride, 0.9%, not expired. And it is 30 milliliters over an hour. Intravenous, and the time is right. It is due at 06:30. So I can connect it to the patient. And this is still sterile, but just to be safe, I'll go ahead and I'll wipe that down with an alcohol swab along with this. So wipe this down for 15. Okay. Now we'll take this off. And that's still clamped, so it won't come running out. Okay, let's now connect those to each other. This over here. Some ground. Just kind of loop it like that. Okay. So the rate was for 30 milliliters over an hour. Okay, let's see. $30 milliliters. And I will go ahead and open the line. That drip. Got a drip. Okay. So now could you check the rate?
Sure. Let's see here. It's 30 milliliters.
Okay, great. So now I'll start this and we'll get our drip. Good. Alrighty. There we go. Alright, so now that we did that, I can just go back into the site, right median, peripheral, time, comments, no, site, administered, IV, sodium chloride, 0.9%, 30 milliliters, for an hour, no pain. Okay, now I'll just put my initials and I'll save that. Okay, so now we're going to go ahead and move on to the next medication, the piggyback. We already said that it's not expired because it expires in 2018, and it's not ripped, it's clear. So we'll just go ahead and do our first check. Could you tell me your name, please?
Shanann O'Connor, age 34.
Okay, thank you. So there we go, Shanann O'Connor, age 34. The medication is imipenem cilastatin, injection, IV. And it starts on Monday at 6:30, and that's when it's due. So the dose is for 500 milligrams, okay, an IV piggyback. So this is going to be IV piggyback, so that's good. Okay, so that's our first check. So now we're going to go ahead and lower this. Okay. Go ahead and do that. Alright. So, lower that so I can... I'm going to do my second check just now and I'll scan, and then before I start I'll do my third. Okay. So we have imipenem cilastatin for Shanann O'Connor, age 34. Could you tell me your name and age again?
Shanann O'Connor, age 34.
Thank you. And 06:30. We're a little late because it's 8:14 right now, but we'll make it. The dose is for 500 milligrams. IV piggyback. And yes. Okay. And this is suitable for the person because we already checked that it can be mixed with sodium chloride in the drug guide, and we know that we have to lower the dose of renal impaired people, and okay, and that's good for infections. So now I'll go ahead and I'll set it up. Well, actually, I'm going to scan it first before I set it up. Okay, so beep, beep. I still have to manually enter this. So, patient ID. 4234 3660. Location D90 B9 F35 19C 249. Okay. Alright, so So you have penicillin, the green light for Shannon O'Connor. Okay. Okay. So now I'll go ahead and I will set this up. So this will be our secondary line, and again with this, it's not a new bag, but we pretend as though it is. So it's all sterile, along with this. Because I'll need that for later. Okay. Go. Make sure that that is locked. Okay. There we go. So I'll put it up here. Actually, I'll prime it before. Okay. I'll just open this up. I will put this here. Try to make it in there. Actually, maybe I will bring it down. Alright, I'll leave it here. Okay. So I'll try to get it in there. So we're going to prime it. There we go. So there are no air bubbles inside of this. As good as you can see. Okay. So we'll just hang it here. And we'll do our third check before we administer this. Okay. So let's see. So we have, could you tell me your name and age again? Last time?
Shannon O'Connor, age 34.
Thank you. I can see I have Shannon O'Connor, age 34, the medication, penicillin, and it will be intravenous. The dose is 500 milligrams, and it is due at 06:30. Okay, great. So we're good to administer this. We did our third check. So I'm just going to wipe this off since it should be sterile, but you always want to be safe with it. So wipe that off. Okay, then I'm going to wipe this one off. 2 for 15 seconds. Close this up. Okay, so now we did check. There's the right person. We did our third checks. I'm gonna just check the rate once more. So the rate is 100 milliliters over 1 hour, and I'll set that up, but I'll have you check it before I start it, just to be safe with it. So 100, and I still have it locked, so it's not going.
Yep, 100.
Okay, great. It's going to be 100 milliliters over 1 hour. So now, go ahead and unclamp it. Make sure everything is unclamped as well. Okay. So I'll just do my comments. So no complications. Administered 500 milligrams. Penicillin, right in peripheral. No pain. Patient. Well. And I'll go ahead and do, since we did already check the IV site, and I initialed it. I'll go ahead and I'll do my IV assessment after we're out of the room, just so we don't stay in here for too long. Okay, did all of that. So now I'm going to go ahead and I'll lower the bed so it's in the lowest position, and if I had to call it, I'd put it there just so she has it. So I'm gonna go ahead. Are you having any pain, Shannon?
No, I'm not.
Okay, great. So, just so everybody knows how long these have been up, I will go ahead and label the tubes and put my initials and the date. There we go. Looking good. Okay, so now I'm going to take these off. I'll wash my hands. Okay. So Shanana, I wanted to do some teaching for you.
Alrighty, dear.
Okay. So I'm going to just grab my paper. So I have a little paper here and a little here. So, do you know some of the side effects that could happen with this medication?
No, what are they?
Well, you could have diarrhea, vomiting, nausea. But if you do have diarrhea, you want to make sure you come in because you could have C. diff.
Oh.
That's something that happens with antibiotics with a broad spectrum like this one, because it kills your normal flora along with the bacteria. So you want to make sure you come in, even if it's weeks after, just come in because it still can happen that far out. And if you are taking any birth control, make sure that you're using another form while you're taking antibiotics, because the antibiotics could make it not effective if it's an oral or hormonal, just birth control. And also, if you like to go out in the sun, make sure you're wearing a high SPF of sunscreen because you are more prone to burning when you're on antibiotics. And just make sure that you're not sharing your medication, that you're following it out as your prescriber prescribed it, provider prescribed it, and just making sure that you finish out your antibiotic dose. Even if you're feeling better, just make sure you finish out the dose that you were prescribed. So what are some of the side effects that I told you about?
It's nausea, vomiting, and you told me to come in if I have diarrhea and make sure I tell you.
Great. Okay. Well, I have this pamphlet on just some stuff about the medication and just some of the stuff that we talked about, okay?
Okay, thank you.
You're welcome, so I'll leave that for you. And if you have any questions, let me know. I'll be back in 30 minutes to check and see how you're doing. But just give me a call on the call if you have any other questions.
Alrighty, thank you.
You're welcome. I'll just show you some more time. So I already lowered the bed, gave the call light. Okay. So did you have any questions for
Yeah, I
me?
have like 3 more questions for you.
Okay.
Were there any pertinent pieces of information reviewed before administering the medication?
Well, first you're going to want to check all the client's labs. She did have a urinalysis done, and it showed that she had cloudy amber urine with an elevated white blood cell count of 15, and she also had an elevated temperature, so we checked that out. And she does have a history of UTIs, so we were suspicious that it could be that, but we weren't exactly sure what it was, so we're administering her a broad spectrum antibiotic. And we also checked to see if she has an allergy to this medication, which she didn't, and she didn't have a cross sensitivity to penicillins or cephalosporins or anything like that as well.
Okay, did this information affect your decision to administer the medication?
It did, because it showed that she does have an infection, so it showed that this antibiotic would be therapeutic to give to her at the moment.
Cool. And did this information affect how you administer the medication?
No, it didn't affect how I administered it. I just Just followed all the standard precautions of administering IVs, making sure you're clean, clear bottles, and just all the stuff we went over with the first questions.
Okay, thank you.
You're welcome.